whether it's activities related to community engagement, it's emergency planning, first responders, neighbors, transportation, housing, even public spaces, banking institution, communities of faith, legal, financial, planning services, and existing programs that support memory loss and services related to those. All of these in a community, in any given community, touch the lives of those who are living with dementia and have a role or could play a role in helping them live their best lives. So really, Dementia-Friendly America is made up of two primary initiatives. The first is community and creating dementia-friendly communities. And the second is at the individual level and amassing a network of what we call dementia friends, and I'll talk about that in a little bit. Dementia-Friendly America is modeled after Minnesota's Act on Alzheimer's. So just a little history here. Back in 2009, so many years ago, the Minnesota legislature charged the Minnesota Board of Aging to establish an Alzheimer's disease work group and to make recommendations on policies and programs that would prepare Minnesota for the future. And from that evolved Act on Alzheimer's, which is a statewide collaborative aimed at fostering collective ownership and accountability and working towards 5 goals: investing and identifying promising approaches that reduce costs and improve care, increasing detection of Alzheimer's disease, sustaining caregivers by offering them information, resources, and in-person support, equipping communities to be dementia capable to support residents who are touched by Alzheimer's disease, and then the very important raising awareness and reducing stigma by engaging communities. So Act on Alzheimer's was kind of the germ of the idea from which Dementia-Friendly America was born, and it is still very active in the state of Minnesota, and has served as a great model for us. So from a governance perspective, Dementia-Friendly America is guided by a national council of over 35 organizations. These are, in some cases, local organizations, national organizations representing law enforcement, representing county government, the legal profession, financial profession, the faith community. It's quite a diverse and eclectic and council, and it includes people who are living with dementia. And we meet several times a year and really provide strategic guidance to the whole movement of Dementia-Friendly America. So the principles of dementia-friendly communities are twofold. One is to include and involve people living with dementia in the community effort. Really following the mantra, nothing without us, about us without us. And that's why we have folks who are living with dementia on our national council and providing a very, very important touchstone for us with reality, with their reality. And the second principle is that this can't be done by any one organization alone. It's all about collaboration. It's all about creating a community-based team that works together to create change. So we have 6 goals, and 2 of them are around increasing awareness and understanding, both of dementia itself and of people living with dementia, and then increasing awareness and understanding of just brain health and risk reduction. Our 3rd goal is around collaboration, as I mentioned before, with public, private, nonprofit, and the healthcare sectors. The 4th is recognizing and addressing the changing needs of people with dementia and their very important care partners. The 5th is creating social, cultural, and business environments that are inclusive. And the 6th is improving the physical environment in public spaces. and in systems. And I will say that, you know, one of the things I do love the most about Dementia-Friendly America is that every community comes at this slightly differently. Every community that is a dementia-friendly community at this point, or a city or a town or a county, has started at a different place. Perhaps they've started with focusing on raising awareness and training first responders, so they understand what somebody who may be wandering may actually have dementia and needs to be treated differently than somebody than if they didn't know that they had dementia. Or training retail workers like the checkout folks at a grocery store to understand that somebody who might be fishing for their wallet at the checkout line and holding up the line behind them, perhaps that person is not being obstreperous. That person may have dementia and may just need a little extra time. In other cases, it's working with the faith community to set up support groups for caregivers with dementia. So it's very organic. And I think that's in part what makes it work. It's dealing not only with a really significant issue for communities, but it's also allowing communities to address it in a way that makes sense to them based on who they collaborate with, who's at the table. And over time, we've seen these, what has started as an initial collaboration, really grow and flourish with the addition of more collaborators. So I want to give you a sense, since we've just finished 2021, of a few of the things that have happened in 2021. So dementia-friendly Oak Park, Illinois is really focused on dementia awareness targeted at different sectors. So they've developed a whole series of training videos, training videos for first responders, for banks, for retail, for the faith communities, for educators, for community-based services and local government, to try to raise awareness about dementia and the importance of understanding what it is and what it means for somebody to be living with dementia. The city of Pittsburgh, similarly, providing education and resources through a community toolkit about dementia-friendly practices and how to create an inclusive and welcoming community for people living with dementia and their care partners. So some of this is sensitivity, some of this is just basic education about dementia aimed at the community at large. In St. Charles, Missouri, they've done something quite unique I hadn't seen anywhere else, but they've gotten the mayor to give them a vacant lot to create a forget-me-not park to really honor the lives of people who are living with dementia and their family members. So I look forward to seeing that park next time I'm in Missouri. In Tulsa, Oklahoma, they focused on the airport, and they wanted to become the first dementia-friendly airport in the US. So they trained airport police and other airport employees. They trained them remotely, but the idea was for those who work in an airport to be highly sensitive to the fact that some of the people who travel through that airport on a daily basis may be people who are living with dementia. And San Antonio, Texas, created a community resource that includes programs, phone numbers, website information to go out to the entire community, 20,000 copies printed and currently slated to go out to reach people throughout the community. What's interesting about San Antonio, and I'll talk a little bit about this in a sec, is that there is also a parallel, perhaps parallel movement that's focused on age-friendly communities. And there's lots of discussion in the early days of dementia-friendly America as to how do we relate to age-friendly? What is the difference? What is similar? What's not similar? And so what San Antonio did was to try to pull together their dementia-friendly materials in an age-friendly manner, easy to read, large enough to hold. So they were applying the principles of age-friendly to their dementia-friendly resource. So I mentioned age-friendly. Early on in this project, we did a crosswalk between the principles and features of an age-friendly community and those of a dementia-friendly community. And I'll have to say that from a topic point of view, they're very similar. But it gets, when you get down to the nuances, it is a little bit different. So for example, an age-friendly principle is to have a spectrum of quality housing options, including those that support aging in place. A dementia-friendly principle is not only to have that range of quality housing options, but to include memory care services and supports, so that those who are living with dementia can also avail themselves of housing. And there are several, in Massachusetts, for example, they've created an integrated toolkit. So they've just gone ahead and said, these are so similar and there's so many parallels that let's just figure this out so a community doesn't invest all of its time in age-friendly without thinking about dementia-friendly, or vice versa. So we're a number of years into this. I think this is year 7, 6 or 7. And the question is, how do we know whether we're making a difference? For a program like this, which I described as very organic and very different from community to community, how do we know that we've actually done anything worthwhile? So we've spent a lot of time talking about how to evaluate this, and it's not easy, but what we have done is developed a template that communities, age-friendly communities can use, or dementia-friendly communities can use to do their own evaluation. So this is just one page out of the evaluation toolkit. But for example, if a community sets a goal of increasing awareness and understanding of people living with dementia and has decided to target schools and younger people, then obviously their high school students are their target audience, and their outputs are the number of people who attended whatever class or session they had about dementia, and they test the results through surveys. So again, it's very flexible depending on what a community has identified as their goal. But what we tried to do was to give communities a bit of a template. Knowing what kind of impact you're having is helpful for not only raising funds to continue your activity, but it's also helpful in increasing the scope of your collaborators, the number of collaborators, and getting them on board. So that's been a big activity, not an easy one, but one that's been important for our work. I want to switch gears for a second and talk a little bit about nomenclature, because when we talk about dementia, there's a lot of confusion. There's a lot of explanations, and there's a lot of inconsistency in how we use our terminology. Dementia is the umbrella term for a number of different forms of dementia, whether it's Alzheimer's disease, whether it's Lewy body, whether it's frontal lobe, or it's some combination of the two. But because we don't have consistency in how we talk about that, it results in a lot of stigma and a lot of isolation for people living with dementia, and frankly, for their caregivers. It also results in delays in diagnosis and care and creates some barriers to public education. So Alzheimer's disease, for example, refers to a pathologic change. It's not a specific syndrome. And it's really only affirmed after death. So symptoms are part of the disease continuum, but they're not its definition. For example, memory, language, attention, or executive dysfunction, disorder, visual spatial skills, social behavior are all syndromes that happen with dementia or some combination of these, but they aren't the disease itself. So I think that's really important for us to remember as we think about how do we reduce stigma associated with, we need to get our language straight. And there is some work being done right now out of the Mayo Clinic on trying to create a unified nomenclature around dementia and related disorders. And I think the important thing is that it's not one thing. It manifests itself differently for different people at different times. And because of that, it does create these stereotypes and confusion. And that's part of the reason why DFI exists, is to try to dispel some of that. So there is also, as I mentioned at the very beginning, something called Dementia Friends. Dementia Friends started in the UK, and with a real focus on learning at the individual level about dementia and turning that understanding into action. And its purpose really is to change the way people think, people act, and talk about dementia. So somebody who wants to become a dementia friend views an online video or attends a live interactive session to learn what it's like to live with dementia. And there are over 103,000 people in this country who have chosen to become dementia friends. Some of these are family members with people who have dementia. Some of them are community service providers. Some of them are work in a bank, for example, and all the bank employees have been trained to be dementia friends. There's some youth, Boy Scouts and Girl Scouts who have done this. So the point here is that we can all learn much more about dementia, gain a greater understanding of it, and by doing so, become a friend to somebody who is living with dementia or their caregiver. Again, a way of reducing the stigma associated with dementia. I wanted to sort of wrap up with showing you this video, and I'm hoping it will work, because one of the communities that has become very,
having excellent vision isn't just about how well you see, it's how you see.
Let me get rid of this ad. One of the communities that has become very interested in dementia-friendly America is the Indigenous community.
For every human being, life is like a river. A constant flow of water represents our daily experiences, from routine and familiar to those that take us by surprise. If we are lucky enough to live a long life, we will experience the river in each of the 4 seasons: spring, summer, fall, and winter. Spring is early childhood, when the river is new to us, and we are just learning about all the fish, birds, and animals that connect with it. Summer is our experience from childhood to adulthood, when we transition from relying on others to navigating the water and harvesting for ourselves. Fall is adulthood, when we know the river and its resources and dangers well enough to provide for others, raise children, and chart our own course in the world. Winter is elderhood, when we have acquired the deepest knowledge and wisdom, but also start to experience changes from the aging of our bodies. Dementia is like a brutal blizzard. Blizzards can come in any season, although they are most common and most severe in winter. The wind and snow mute the sight and sound of the water. Everyday experiences, the natural flow of the water, become harder to appreciate and navigate. Thinking activities that used to be easy, like planning a fishing trip, buying bait, planning meals for the day, and reaching out to others to join the activity, become increasingly difficult. However, even at the onset of the blizzard, emotional experiences and feelings remain strong. The love of fishing, the memory of the sunlight gleaming off the rippling current, and the joy of company, for example. The progression of dementia is like experiencing a growing blizzard without end. The prolonged exposure to cold starts to freeze the river. The everyday flow of experiences beneath the surface is increasingly difficult to reach and navigate without help. Eventually, even deep and lifelong emotional and spiritual connections are harder to access through the thickening ice.
Oh. All right, wait a minute. Oh dear. Am I back with you all?
Yes, you are.
Okay.
Did you intend to show a video or the audio? We only saw the audio.
Oh, you did?
Yeah.
Well, let me see if I can do that then. I thought I was showing a video. Well,
No, we all heard the audio. I tried to find this address and I couldn't find the YouTube either.
well, you heard the message, which is what is most important here. What I was saying at the outset is that the indigenous community of elders has become engaged with dementia-friendly America in their tribal communities, and this is just beginning to spread through lots and lots of communities. I think our friend who presented the sort of analogy of the river said a couple of really important things, and one of them is that it is a progressive disease, and it's a progressive situation. But I also would like us to think about what if we thought about dementia as not a disease, but as a disability, would we think about it differently? Would we think about it, less as something that has a finite end, but something that can be lived with for a long time? And many people do live with dementia for a very long time. So I hope you'll join the movement in your community. There are hundreds and hundreds and hundreds of dementia-friendly America communities, counties, cities, neighborhoods around the country. They're all listed on the Dementia-Friendly America website, listed by state. And consider being dementia friend. At the end of the day, it's really all about equity. It's about inclusion. It's about access, and it's about awareness. And I think all of us, many of whom have been touched by people living with dementia in our own families or in our neighborhoods or among our friends, would recognize the importance of trying to address the stigma and the isolation that comes with living with dementia through a program like Dementia-Friendly America. So I will stop now. I'm happy to answer questions and engage in a conversation with you.
Thank you so much, Katie. Great presentation. Your presentation has been a wonderful start for our seminar series. I would like to, one thing before we begin with the discussion, is it possible for you to send us the link for the video so that we can perhaps watch it later?
I'd be happy to do that. I'm
Yeah.
sorry.
And then I can put it, or Haley can also put it online and share it with the participants. Okay.
I will try to do that while we're talking here, if I can figure out how to do it. Okay.
Okay, I have a question. This is from the chat box. The question is from Lori Thick. Can you talk about whether anything is being done in these dementia-friendly cities to diminish the loneliness or social isolation experienced by many people with early onset dementia?
Yeah, it's a great question. And I would say that there's a lot of communities have established support groups for caregivers and those with early onset dementia, recognizing that it's a very lonely place to be. It often happens to people in their 50s and when they're least expecting it. So it's really important to have colleagues and friends and others who are experiencing the same thing. So yes, it's most of that is through support groups, many sponsored by community-based organizations, some sponsored by faith-based organizations, some churches and synagogues. But it's a great point, and glad you raised it.
I I have a quick question about how to join, how does the community join the existing dementia-friendly America network of communities?
It's a great question. So you go to dfaamerica.org, and there is a whole roadmap for how you join a dementia-friendly America as a community. And then there's also a similar roadmap for how you become a dementia friend. And you can be a dementia friend without being a community, just as an individual can do an online training program. It's off. What I found is it's nice to do it with other folks, members of your staff, members of your team, members of your church, because you can learn so much by talking to one another and being together.
Are dementia friend champions the same thing as dementia friends? I have heard quite a bit about dementia friend champions as people who are trained to lead the dementia movement in their own communities.
Right.
Is it the same?
Yes. Well, dementia friend champions are those who often lead the training for dementia friends, but you don't have to have a champion. You can do it online as well. So recognizing in the world of COVID, we can't do things face to face as much. So there is online training.
I have another question here from the chat box from Nora Dowd. We have an active, age-friendly, livable communities group in Philadelphia. Much of our work seems synergistic. How can we work together?
It's a great question, and it is very, I mean, I don't know exactly what Philadelphia is doing with its age-friendly, but at least I know in DC it is very synergistic. And, you know, in some cities, like in Montgomery County here in Maryland, the age-friendly and the dementia-friendly initiatives work very closely together. They're led by the same person, and it's really adding a dementia overlay to what you're doing with age-friendly. So if you're thinking about, I don't know, making it up here, transportation services in Philadelphia and having covered bus stops and longer lights for people to be able to get across the street, think about what that would mean for somebody living with dementia and whether you would make any changes to that. So a lot of it is just having that, using that lens as you're thinking about what you're doing as your age-friendly Philadelphia priorities. There is a link in the slides to sort of a crosswalk that was done by AARP. I'll send that to you, Nora, and you can see whether that's maybe helpful to you.
Another question from the chat box is from Lori Thick. Do you know if the support groups are available online?
It depends where they are, but some of them are definitely. I know here in Washington, the Iona Senior Services has support groups that are online. More and more of them moved online with COVID, and I think that they've proved to be somewhat successful that way. There's also, so yes, I would find a community resource in wherever you are that serves older adults, and undoubtedly they will have support groups or know where the support groups are. I see a comment here about the arts. Absolutely, they are a powerful tool, and there's been a lot of wonderful examples and wonderful research done about the arts and how it helps those who are living with dementia, both with memory, recall. Some of it is very calming for them, and there's been just some great, whether it's music, whether it's the physical arts, acting. There's just been some wonderful, wonderful programs around the country that have used the arts as a wonderful tool.
did you have any general insights on how does the community join the existing, how to start a dementia-friendly program in a given community or a state?
So I would say the first thing to do is to go on the website and just sort of see what the roadmap is. But the second thing I would do is find some community partners. Start small. So if you reach out to the banks, reach out to first responders. One of the first meetings, I would just say, of the National Council, we had first responders from Montgomery County, Maryland, come and talk to us about how their understanding of dementia was increased through the training they got through dementia-friendly Montgomery County. And they were talking about as fire, so I think there was 3 firefighters and 2 policemen who came to the meeting and really talked about how it's helped them in their job understand how to address citizens that may be seeking their services or in need of their services, how it's helped them become much more sensitive to it. So they were so enthusiastic about the impact that it had on their ability to do their jobs better. So that's a good place to start, or with a faith community. But I think it's finding a few key partners. It doesn't have to be a lot, 2 or 3 at the outset. And then starting from there, and it's everyone go by the philosophy of everyone brings somebody else to the party, right? So each one of your initial partners brings somebody else, and then somebody else, and soon you'll grow quite large. And then I think it's finding out what is most important to you to do. What's the low-hanging fruit in your community? In the city of Denver, I know they were really focused on the business community and retail, and worked with small business, worked with shops and realtors to try to do a lot of training among realtors, knowing that people who are living with dementia are out shopping. They're out in the community. Yeah. And if only we were more sensitive to what their lived experience is, we could serve them so much better.
We have another question here from Janet Annunciata. Are you aware of any data that shows the positive effects of dementia-friendly communities? For example, people living with dementia are able to live longer in their communities because of increased support and acceptance?
I don't know of any data like that, but sort of anecdotally, I mean, not any firm data, but anecdotally, there's no question that people can live longer when they have the supports that they need around them. And, as I said, dementia takes many forms, and it also manifests itself differently for different people at different times. And so having the ability to be surrounded by people who understand what you're going through, what your lived experience is, and providing that support helps people stay as independent as they possibly can for as long as they can. It's hard to collect data like that. Really hard. Wouldn't it be wonderful, though?
You talk briefly about one of your slides, if I don't remember wrong. You talk about how to evaluate, how to collect indicators of success to evaluate whether or not the dementia-friendly movement was having an impact in the community. Are you aware of any movement or local movement actually collecting data, the data that you show in that chart?
Yeah, so this is the year that they would be doing it, because we just finished that evaluation template last year. So it's now out there in the community for all of our dementia-friendly communities to begin to use. And a lot of the data that's going to be collected is through surveys and interviews with the people impacted. So I would say, ask me that question a year from now, and there'll probably be I probably have some data to share with you.
That was my last question from the chat. Yeah, I don't, there's some really nice sites that people have volunteered to provide. I hope that that you can see this a site on the community partner.
No, it's great.
And another site, a resource for benefits of the arts from Janine Trursini. And one person again asking for the link to the video and the slides.
Yeah, I'm going to try to see if I can do that right now.
And
I can, let's see.
yeah, and I can also send, I have the list of attendees. I can also send, if you cannot find it or figure it out right away, I can send the links and also the slides to all the attendees.
Yeah, I'll send you these. I'll send you the whole package.
Wonderful, wonderful. Well, I would like to thank everyone for attending this first webinar in our webinar series, and please stay tuned for our next webinar to be held next week on Tuesday, January 18 at the same time at noon. Well, thanks again, and this has been a great presentation. A lot of important information to follow up in the future presentations in our webinar series. Thank you, and take care, everyone.
Thank you.